Hi everyone, today we are going to learn about acute pancreatitis. So when you have a patient in your OPD or in emergency where patient has come with epigastric pain where it is radiating to back. He can also have vomiting, then the diagnosis can be acute pancreatitis. So let us learn within 5 minutes what is acute pancreatitis. It is an acute inflammation of pancreas which is because of premature activation of pancreatic enzymes. Do you know what happens because of this? It will cause autodigestion of pancreas. So etiology you can learn from this mnemonic: I get smashed. I for idiopathic, G for gallstones, which is very common, E for ethanol, T for trauma, S for steroids, M for mumps, A for autoimmune, S for scorpion sting, H for hyperglycemia, E for ERCP, and D for drugs. But in Viva, if it is asked, then most common causes will always be gallstones and alcohol. So what is the result? What happens when you get this pancreatitis? There is inflammation, as we discussed earlier. Then there is edema. Okay. Then there will be fat necrosis. Hemorrhage can be there. Systemic inflammatory response can be there. Now let us discuss about clinical features. So as I told you, epigastric pain, this will be sudden and severe. There will be, the pain will be actually radiating to back. Nausea and vomiting. And when you lean forward, then it gets settled. When leans forward, then this will get settled. Pain actually settles. On examination, you will see tenderness in epigastric region. You can have tachycardia. There can also be fever. Severe cases may, you can see Cullen sign, which is, your periumbilical discoloration. There can be gray Turner's sign, which is flank discoloration because of hemorrhage. So these two signs are important: Cullen signs and gray Turner's signs. Lab findings would be amylase. Amylase and lipase will be increased. Amylase will be increased. Lipase will also be increased. This is more specific. You will get ultrasound done, look for gallstones, then contrast CT to see severity and assess any complication. Now let us discuss about complications. then it will can be systemic में you can have shock, ARDS हो सकता है, you can have acute kidney injury, multi-organ failure. Now let us discuss about management. IV fluids are important. Aggressive hydration is needed. Pain management. Oxygen is given अगर requirement होती है तो it can be given eternal enteral feeding. Also, you have to treat the underlying cause. Let us discuss high yield exam points. Very important. Most sensitive enzyme, most common cause. These two questions can be asked. Most as sensitive enzyme will be lipase, serum lipase, and cause will be gallstones. So if the patient is leaning forwards, if the patient is leaning forwards, then leans forward and pain gets relieved, then possible is only acute pancreatitis until proven otherwise. So you will always think कि acute pancreatitis है अगर कोई lean हो रहा है आगे की तरफ and उसका pain relief हो रहा है तो. Okay, so thanks for watching. Comment below any other topic you will like to see. I will make a video on that. Thank you.